And thanks everybody for joining us today. So before I begin, I'd like to acknowledge that I'm on the lands of the Kaurna people, which are First Nations, Aboriginal and Torres Strait Islander people and traditional owners of the Adelaide Plains. And I'd like to acknowledge that sovereignty was never ceded, always was, always will be. So while you're only seeing me on the screen today, I'm part of a broader research group called Better Start, co-directed by myself and John Lynch at the University of Adelaide. And while we're a diverse group, we do come together in our use of administrative linked data to inform policy and practice over a range of areas to contribute to achieving better outcomes for children, families and communities. So today I'm going to talk about work in progress is really the category we fall into, for which we're using the Better Evidence, Better Outcomes linked data platform. So to give you some idea of the data platform we've built over the last decade for me, and John actually started building this back in 2009. So it's been some time and quite, millions of dollars that have been invested in building this platform. As you can see, each of the tiles on your screen represents a different data source. So that spans education, social services, justice, and health sectors. So it's all de-identified and linked through a third party. And now it includes all children born from 91 onwards. So our oldest birth cohorts are in their 30s. And importantly, so the birth cohorts are eligible to be in the platform either if they were born in our jurisdiction or if they touch any of the services you can see on the screen. So that's really important because then we're able to do analysis that reflects the population seen by those services that contribute data to the platform. Another aspect to note is that we describe the platform as enduring and updatable. And what that means is we have programmatic research ethics approvals and programmatic data custodian approvals and extensive governance as well around, Indigenous data sovereignty, which enables us to continue to add new data sources and new birth cohorts to the platform. So that's quite different to some of the data linkage models that exist where you get approvals to build, a linked data set for a particular purpose, and then that has to be, destroyed and you have to start again. And so, this is something that John really pioneered and pushed for as a much more efficient use of resources, and scarce research dollars that fund actually the build of these sorts of platforms. And one of the other innovations we've added to the platform over the years is a family file. So we're able to locate children within their families using birth registrations data. And while that's obviously only one particular type of family, that's the best we can do at the population level at the minute. But what that means for the data platform is we can also see parents' experiences across a number of these services, spanning everything from child protection, hospitalizations, mental health, adult corrections. And that's really important when we're thinking about trying to inform policies, service design and delivery for children and families, because so much of what happens to children is, of course, related to their care environment. So what do we do with the data? Well, there's really three common elements in the way we think about that, and that spans description, prediction, and causal inference. And today I'm really just going to go through a project that's really in the sort of design or co-design phase, even with the South Australian government, focusing on evaluating a rather significant investment in the early years in South Australia. And I suppose one of the reasons we're in the frame and in partnership to evaluate the outcomes of this investment is because by creating a platform like BEBOLD, we have as close to the whole population in our jurisdiction as possible without, for example, doing, a census every year. And because we have that whole population and we're able to update the data platform, That means we can add new data. So that's the little diagram at the bottom there. And we can actually locate the individuals who receive, the new service, policy, investment, etc., and also create what we would describe as a matched comparison group, and then follow both groups forward to understand their longer term outcomes using various quasi-experimental methods, depending on what we're doing. So that's really one of the key uses of the platform. And the example I'm going to touch on today is really focused on the early years and some of the recommendations and the flow on investment and design of really how we're thinking about supporting our 3-year-olds and our 4-year-olds to achieve better outcomes going into school off the back of a Royal Commission that was held in South Australia last year. So the motivation for the Royal Commission in South Australia was essentially, when compared to the rest of the country, we weren't doing so well when it came to levels of developmental vulnerability on school entry. So that's off an instrument that we call the Australian Early Development Census, but that you might know of as an adapted version of the EDI, or the Early Development Index, out of Canada. And so what was created was this really effective narrative around the fact that South Australia, over all the cycles of the AEDC, had really not managed to improve our levels of developmental vulnerability, which was in contrast to most other jurisdictions. And we sort of stayed at the point where we had about 23-24% of our 5-year-olds starting school being classified as developmentally vulnerable on this tool. And so in came a Labor government after only one term out of government. And one of their commitments was actually to launch a Royal Commission into early childhood education and care. And there was a lot of, I suppose, discussion around their commitment to the early years and to early intervention and to investing into better starts for children. And so that's where this Royal Commission came in. And the first recommendation to come out of the Royal Commission was actually based on research that we did that we won't go into today. But the crux of it was this long-term 20-year target. So just a single target out of the Royal Commission, which was to reduce the rate of developmental vulnerability at school entry from 23.8% down to 15%. So this was seen as a very ambitious target, but also in the light of thinking about how targets can unify, investment and effort, both within government, but also across the government and non-government sector. So, of course, that first recommendation out of the Royal Commission was accepted by the government, and a significant amount of investment has now flowed into that. So, in Australian dollars, I think the investment now sits at about $1.9 billion over the next 10 years. So that's, really the biggest investment we've seen in early childhood in quite some time. And everybody is, involved and actually invested in this, in making sure that the funding gets spent in a way which really does improve outcomes. So with that goal in mind, where do we come in? So we've got this 20-year goal that's described as ambitious. There's no really examples of how you might do this. And, if we flow forward what that might mean across the 3-year cycles of when we actually understand developmental vulnerability among children entering school, we get to the point where we're going to have to prevent about 1,600 children who would otherwise have become developmentally vulnerable from starting off school as developmentally vulnerable. So that's out of a birth cohort of about 18,500 to 20,000 per year in South Australia. So it's not a small number. Now, obviously, off the back of that, there was this real investment in South Australia around expanding, because we currently only have 4-year-old preschool, but also expanding that into universal 3-year-old preschool. So I know there are many other areas who already have universal 3-year-old preschool, but we've never had that in our jurisdiction. So that universal investment is new and also, as you can imagine, quite costly. But of particular interest to us was this additional targeted investment, recognising the contribution of all sorts of background factors related to disadvantage to child outcomes. And that was that for a number of children, so 1,000 children in each year, so at age 3 and age 4, they would actually receive a higher dose of preschool. So the universal offerings for 15 hours, but for 1,000 children, the government's going to fund 30 hours per week of preschool. And the Royal Commission was really recommending using linked data to actually target this investment, and then providing this higher dose preschool in integrated hubs so that we could provide additional supports that really look to actually address the background disadvantaged circumstances that are also driving these outcomes. So we have this universal investment, but then we also have this investment in higher dose, so double the dose of preschool per week. Let's use linked data to actually make sure we get the targeting right. And let's think about what additional supports look like and how we might provide these. So beyond the preschool offering, what do we need to do to improve outcomes for these children? And so that's when we come in with the platform that we've built. So we have the BEBOLD platform, which we have multiple examples now of how we've used that for monitoring and evaluation. And, you know, 3 of the key questions we think about is, can we use this sort of data to know who are we actually reaching with these investments? It sounds like a simple question, but from a system perspective, we're not often able to say, these are the children, families, individuals we've reached with this investment. So could we even get to that point? Are the services actually effective when we do reach them? And then while they might be effective for some groups of the population, are they actually supporting us to do what we describe as actually turn the curve, so we start seeing those population averages shift? But of course, one of the things we also know is that while we've managed to bring an incredible richness and breadth of state-based data into the platform, that does largely focus on lots of processes. And we have less data on what we describe as service delivery or receipt of supportive services that we actually think might improve outcomes for children and families. So the challenge for us in thinking about, well, how will we actually evaluate the impact of this investment and this change in provision of preschool and the higher dose and the additional supports is what that would take. And so I guess we're actually in quite a good position in South Australia, because I've been leading a project now for 3 years, because we're a federated system. We have data collected at different levels, as do many of you, I'm sure. So our version of, you know, the local area, thankfully, is actually the whole state. But then there's a lot of administrative data collected at the Commonwealth level. So we've been working for 3 years now to bring that in, which is timely in the context of this investment and actually being able to support understanding what the impact might be. So we're now in a position as of early next year to be able to say, well, we actually think we'll be able to have a view of the reach and retention of that targeted higher dose 3 and 4-year-old preschool. And then beyond that, we'll be able to investigate the impact of that investment, and then look to work out, are we actually shifting those population averages beyond that targeted investment? And so for us, that will mean using that Commonwealth data, because really importantly, it's adding data on childcare enrolment and attendance. So that's from birth onwards. We are working with the government agency now on what data actually needs to be collected for that targeted preschool offering and the new universal offering. We know we can bring in data on the quality of those care and preschool offerings. And importantly, we're bringing in new data on actually what's happening with the family. So what are all those background circumstances that might otherwise impact their outcomes that we need to know about to support the use of quasi-experimental methods? And so I'm going to stop there. So this is, as I mentioned, you know, really our work in progress. We are looking for co-funding opportunities now, partnering with government and some of the not-for-profit service providers. So I hope to be able to come back in a year or so to let you know what our progress has been.